Hello viewers, this is our guest today. His name is Mr. Joe and he and I will talk about coronary heart disease. How are you, Mr. Joe?
I am good and excited to come to your show. How are you?
I'm good.
Let's start. Coronary heart disease, which also in short form is CHD, is a narrowing of the small blood vessels that supply blood and oxygen to the heart. CHD is also called coronary artery disease.
In causes, incidence, and risk factors, the coronary heart disease, which in short form is CHD, is the leading cause of death in the United States for men and women. Coronary heart disease is caused by the buildup of plaque in the arteries to your heart. This may also be called hardening of the arteries.
Fatty material and other substances form a plaque buildup on the walls of your coronary arteries. The coronary arteries bring blood and oxygen to your heart. This buildup causes the arteries to get narrow. As a result, blood flow to the heart can slow down or stop.
A risk factor for heart disease is something that increases your chance of getting it. You cannot change some risk factors for heart disease, but others you can change.
The risk factors for heart disease that you cannot change are your age. The risk of heart disease increases with age. Your gender. Men have a higher risk of getting heart disease than women who are still getting their menstrual period. After menopause, the risk for women is closer to the risk for men.
And also your genes. If your parents or other close relatives had heart disease, you are at higher risk.
Right. The symptoms may be very noticeable, but sometimes you can have the disease and not have any symptoms. Chest pain or discomfort, angina, is the most common symptom. You feel this pain when the heart is not getting enough blood or oxygen. How bad the pain is varies from person to person.
It may feel heavy or like someone is squeezing your heart. You feel it under your breastbone, also known as sternum, but also in your neck, arms, stomach, or upper back. The pain usually occurs with activity or emotion, and goes away with rest or a medicine called nitroglycerin. Other symptoms include shortness of breath and fatigue with activity, also known as exertion. Women, elderly people, and people with diabetes are more likely to have symptoms other than chest pain, such as fatigue, shortness of breath, weakness.
In signs and tests, many tests help diagnose CHD. Usually, your doctor will order more than one test before making a diagnosis. Tests may include
coronary angiography/arteriography, an invasive test that evaluates the heart arteries under X-ray. Connecticut angiography, a non-invasive way to perform coronary angiography. Echocardiogram, electrocardiogram,
Well, that's all for today, I guess.
Bye. Take care.
Bye.